The CDC is blaming the nurse's infection on a breach in protocol. Our Dr. Jon LaPook is in Washington tonight with more about that. John?
The protocol for treating Ebola is complicated. Here's just one step from the CDC guidelines. As you are removing the gown, peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. So the hospital staff in Dallas may not have had time to properly train for a disease they likely never expected to see. So we sat down with Dr. Anthony Fauci, the head of infectious diseases at the National Institutes of Health, and asked about the challenge of training hospital workers. How long does it take for the workers to be adequately trained?
It takes a while.
What's a while?
It could take a couple of weeks. So it's not going to happen like, okay, go through it once.
In Dallas, we thought that the protocol was handled perfectly,
but the training,
things went wrong.
Quite frankly, the training was the proof of the pudding. The training was not adequate. It was not adequate. The training was not adequate. We've got to make sure the training is adequate so that if a patient comes in to a hospital and that hospital is taking care of the patient, that it isn't passive instruction. Read this, go that. It's active instruction.
There are a lot of nurses and other healthcare workers who are really protesting.
Exactly, and that's the reason why the training needs to be ratcheted up in a very proactive way.
Do you think it's going to be done?
It is going to be done. It is being done.
But saying it so and making it so are two separate things.
They're doing it right now. There's a team now, a CDC team in Dallas that's on site now monitoring things to make sure that that training really gets done.
There are currently 4 centers in the United States where staff are specially trained on how to handle diseases like Ebola. They have successfully treated 5 patients. Dr. Fauci said the government is considering using them for future victims, but has to resolve issues such as how to transport patients without spreading the infection.
Jon LaPook in our Washington newsroom tonight. John, thank you.